Hello everyone, welcome back to Bite Size Tech for Busy GPs, and today's episode is about EMIS tasks and walkthrough of certain easy activities in EMIS, common activities in EMIS. This is particularly useful for those who have not yet used EMIS. So today I'm just going to focus on patient access messages, medicines management and results management. Okay, so on your EMIS homepage, you should be able to see this, I've circled it in red here, almost like a dashboard. And if you clicked on any of these hyperlinks, it should bring you up this page, which is your tasks page. So the orange arrow here shows all the available tasks, and we're going to look at tasks, lab reports, medicines management today. Document management is another topic which we will cover at another episode. Okay, so let's go on to tasks. Here you have your own personal tasks, your to-do list, and if you click on that, it would come up with a list of what you need to do. Then I think for practices like ours who have activated patient access messaging service, we will then also get tasks this way. So patient messaging via the app is a form of asynchronous messaging. So we stipulated on our website to the patients that any message they send is routine and will be responded to within X number of days. And if they have anything urgent, they need to phone the practice. So if they had a routine query, they could use that messaging service and it would come here. If you can't see anything here, it could be because you haven't got any personal messages to yourself, at which point you might have to go into global view. So to do that, I circled it red here, go into workflow view, drop down menu and choose global view. You should then be able to see all of the incoming messages. So in this particular instance, we have a patient who has done an online request for medication. So we've got a number of choices. When we open it up, by double clicking on it, we should be able to see the full message and the ability to reply. We could go back into their clinical system to have a look at their details. We could choose to reply directly here. We could choose to book them a telephone appointment and let them know about it, or call them straight there and then, or we could send them a text message to remind them of something. There are many ways of doing it, but essentially it is just a form of text communication with the patient. And we do try to keep this to a minimum number of transactions if possible. We don't want to have long-winded conversations with patients to and fro on this platform. Okay, so that's the messaging bit. Then the next bit would be medicines management. So it's quite intuitive. You just click on each of these lines, it'll open up the workflow for each thing. So here we can see under medicines management, the orange arrow showing you requests with queries and awaiting signing. So the majority of these will come from our administrator or receptionist who are processing written requests for medication, repeats, etc. But increasingly we are seeing more and more online requests from patients themselves using an online app. So anything that says online here means that the patient has requested their medication themselves. This is something we really want to encourage because it would reduce our own admin staff time if the patient can take it upon themselves, and also gives the patient more control over their own health. So if we saw a medication and we wanted to remind the patient to come in for a review, or we didn't want to sign it straight away, we could send an SMS to them using @QRX. And there are a set of templates here that we can choose to reply to the patient. There is also an option if the patient ordered the medication online. There is also an extra box at the bottom of their request when you come to sign it that allows you to write a message, and that message will go back to the patient's access app. So the patient will be able to see it directly that way. Okay, then we can go on the next one with the results tab. If you click on the results tab, you'll see a list of your results. And if you double click on them, it will come out with your workflow like so. I've tried to cover as much as information as I could, so I hope you could still see what we're trying to do here. So on each result, if we double click on this left toolbar, these are all the patient names with their results. If we double click each one, the actual result will come up in the preview here. Then we can click File and Comment. And under File and Comment, there's a drop-down menu, which you can see where the orange arrow is pointing at. If we drop it down, now the reason why we've renamed it the way in such a way is to make it more patient-friendly, because we're at our surgery, we have actually activated the ability for patients to see their own results on patient access. So when the patient looks at their results, it would be associated with these comments, and we want the comments to be as easy to understand as possible. So things like, we've already dealt with it, or please book. So it's more direct to the patient, really. And then there's a bit here that says GP advice. So if you click that, you'd be able to free text any advice that you want to give to the patient. Then there are certain letters that we've also created, which is such as the cholesterol letter, the National Diabetes Prevention Program letter, the vitamin D letter. So if we click any of these and send a task to our admin, they should be able to send the patient the relevant letter. Okay, so the next thing really is to create referral letters in EMIS and to find out where they are all kept. So if you go back to our dummy patient, create a new consultation, which would be under Add. This window will come up. And then under Documents, if you clicked here, then you should be able to bring up this box, which is the document template chooser. If you're a new user, you wouldn't have anything already pre-populated. But usually if you've used a document already, it would come up in here next time. If you can't find the document, go to the magnifying glass, shown by the orange arrow here. And you should then be able to see a list of various documents. So for our area, we use the Arden's templated document so that it continues to be up to date and relevant to practices. So it's really useful. So all we have to do is to go into the shared folders menu and you choose the drop downs and choose Arden's. Merton is where we're currently at. And it will come up with all of the most up-to-date referral letters that we need. Again, if you've already used existing letters, then the templates will come up here as frequently used. Then for admin staff, there's also other sort of recall templates such as smear leaflets, letters, child protection letters, which are quite useful because when a safeguarding requests for information come in, rather than free texting a letter, there is actually a set template under saved under here under child protection letters, which we could choose, and it pre-populates all of the relevant information such as immunization dates, last A&E attendance dates, last date seen by GP, i.e. it imports the last consultation. So it's a really useful tool to create these standard safeguarding letters. Okay, so in my previous episode, we talked about creating an electronic referral. And so I just want to touch on this time how to follow up on a referral. Potentially you might have had a pending referral and you weren't sure if it had sent, or if you had requested a referral but you didn't know if the patient had booked it or had an appointment, etc. You can go back and look at your electronic referral work list, and I'll show you how to do that here. So back to our dummy patient. I've circled in red here, this little icons of blue and blue looking icon. This is the chosen book or the ERS icon. So if we clicked on that icon at the top of our page, if you don't have that icon, please ask your admin to add it. You can easily customize it up here. So you click on that icon, it will bring up the ERS home page. So normally this is what you would see on the home page, and if you wanted to search for a patient that you had already done a referral for, or in fact if you wanted to know if those referrals been sent for the patient, you just need to put their NHS number. If you already have their booking number, their reference, because they'd already been referred, you can tick UBRN, which is that reference, and you can search under that number instead. Click search and it will come up with the patient details and what they've been referred to on this homepage here. And you would be able to activate or cancel or book or do whatever you like with that referral. So today, but this time we're talking about work lists. So on the next tab along, the orange arrow is showing you is the work list. So if we clicked on that, we should then be able to see all of the work that is currently pending for a referral. So you can see here, work list type, referrer action required. So that's how you can filter it. And then you can filter it according to each clinician. So if you choose a clinician, it would show their outstanding referrals that hadn't been done yet. So if you click load, that will show up. And simply, you just have a look at what you haven't done yet, click on it, it will bring up the patient details, and then you can complete it and follow the steps that way. Thank you for listening, and I'll see you again soon.